Hello, my name is Jesus, and today I will be covering a presentation about COVID-19, otherwise known as the coronavirus. So, how many countries do you think have confirmed cases of the coronavirus? Maybe 50, 100 countries, 150 countries? Well, the answer to this 4 weeks ago is 54 countries. The answer now, as of today, March 27th, it's over 170 countries, and that is according to the World Health Organization. The state of Illinois itself has announced a total of 3,026 confirmed cases with a total of 34 deaths. And this is very relevant to us because we are students in Chicago and Chicago is located in Illinois. So the origins of the coronavirus, it's been around since about 1965, and there are various kinds of coronaviruses, various different formats, and they all come from animal origins. The first of its kind was B814, and it comes from human embryonic tracheal organ cultures. This basically means that it comes from the tracheal organ, which is located around here in the throat, and the virus did originate on the tissue of it, and this is according to Comm. The next kind is NL63, a Group 1 coronavirus. The Group 1 coronavirus is related to 229E. I will touch on that later. And it is a virus that does spread. It does come from pigs. HKU1 and SARS are Group 2 coronaviruses. Group 2 coronaviruses are the newest of its kind, and they are the most harmful and most developed. B814 was discovered by Tyrrell and Bino here in the US in the 1960s. NL63 was discovered in 2002 and 2003 in Guangdong, China. HKU1 and SARS were discovered in this recent coronavirus outbreak that started in late 2019. And as I said before, all coronaviruses originate from animals. That includes rats, bats, cows, llamas, pigs, camels, and various other unknown animals. So, from B814 to 229E, Tyrrell and Bino, along with a combination of another known virus, Hammer's virus, created 229E, which is another kind of coronavirus. When 229E was closely examined, it was another kind of virus was discovered, OC43. Both were very impactful. While 229E was more subject to epidemic-like characteristics, OC43 was linked more to localized outbreaks, meaning that OC43 did have a smaller impact in the community. These are early developments of the coronaviruses, and all coronaviruses are in fact respiratory viruses. This means that reinfection can occur, and these early generations are also more common in children. NO63, another coronavirus, was discovered through a 7-month-old girl with coryza, conjunctivitis, fever, and bronchitis in 2004. This virus is closely related to Group 1 virus 229E and can cause upper or lower respiratory tract disease, or even both, according to Comm. This led to the discovery of New Haven coronavirus. This virus was primarily found in children under 5 years of age, according to Comm. Both of these two viruses have actually led to increased risk of contracting other illnesses, including Kawasaki disease, and they do lead to vulnerability. Group 2 coronaviruses were more common in children than in adults. HKU1, a Group 2 coronavirus, while being more harmful to the early forms, can lead to mild upper respiratory diseases in immunocompetent hosts. HKU1 can be severe in infants, younger children, and with the elderly, as we are seeing now with the current coronavirus. MERS-CoV, otherwise known as Middle East Respiratory Syndrome, actually developed about 10 years ago, 10 years after the SARS in the Middle Eastern countries. I will touch on SARS next. Middle East Respiratory Syndrome coronavirus It does cause severe respiratory syndrome in humans, and as recorded by the CDC, 3 or 4 of every 10 reported cases resulted in death. MERS-CoV also caused more severe complications, including pneumonia and kidney failure, and this is according to the CDC. SARS-CoV and SARS-CoV-2, otherwise known as severe respiratory syndrome, they are what we are currently seeing now with the current coronavirus. SARS-CoV, there was an outbreak in 2003 in China, and it did infect thousands, but it wasn't as impactful as SARS-CoV-2, which is also known as COVID-19. This is, because they are very similar. Symptoms for both did include fever, headache, diarrhea, shivering, and shortness of breath, and this is according to the CDC. As I mentioned before, the COVID-19 outbreak isn't the first of its kind. There was one in 2003 and another previously in 2012. SARS-CoV, the first of its kind, the first outbreak, according to the CDC, the total number of people infected were 8,098 and deaths were 774. Comparing this now to COVID-19, it's not very comparable. So when I started my research about 4 weeks ago on COVID-19, the number of confirmed cases was 87,137 with 2,977 deaths, and this is according to the CDC. When I updated my research as of today, March 27, 2020, the number of confirmed cases skyrocketed to 509,164 confirmed cases with 23,335 deaths, according to the CDC. What I advise are many safety precautions, flu vaccines, taking sanitary measures, and using disinfectants. So washing hands, using hand sanitizer, covering your mouth when you sneeze or cough. In conclusion, coronaviruses are not anything new to humans. They have been around for decades, but COVID-19 is much different from the past variations. The way to prevent this from spreading is essentially by staying home and being sanitary. Remember to wash your hands and to cover your mouth when you sneeze and or cough. God bless.